Thank you, Cathaoirleach. And Minister, you're very welcome here to the Chamber this morning, and thank you for being here and thank you for addressing my question. My commencement matter relates to the lack of provision for the administering of the flu vaccine in locations other than general practice surgeries and community pharmacies. The reason I raise this issue today is related in part to the provision from the HSE that children aged 2 to 12 will be able to receive a free flu vaccine from mid-October, which is new in 2020-2021. This welcome development comes on the tail end of much talked about difficulties in staying safe during the return to school for over 500,000 primary school students across the country. Unfortunately, I feel that the restrictive manner in which the vaccine is to be administered will lead to an undesirable overcrowding of GP offices and pharmacies, as well as resulting in a lower uptake than would otherwise be seen. While GPs and pharmacies have done terrific work throughout this country's fight against COVID-19 and continue to do so, they are not designed to be mass vaccination centres, especially when the matter of social distancing is considered. Additionally, there exists a shyness among the public to visit these places unless absolutely necessary, out of fear of contracting the virus. This fear, founded or unfounded, does exist and is particularly prevalent among older members of society who are at increased risk from COVID, unfortunately. It is also the case that these individuals are at increased risk from the flu, which is responsible for 500 deaths each year on average. We are therefore left with a state of affairs whereby the likes of over the 65s in this country, who stand to benefit the most from the flu vaccine, are among the least likely to wish to visit the places administering it. Would it not be of great benefit to these people and many others to make use of the various outreach hubs that exist in their communities, like parish halls, community halls, or even workplaces, which could be occupied for a time by existing HSE teams in order to use the COVID slogan, flatten the curve, of GPs and pharmacy attendants? In the same vein, given that this vaccine is being offered to so many children of primary school age, why have the Department and the HSE not opted to utilise the existing framework of the HSE school vaccination teams, which are long established in this country and have been used to great effect? I've been in contact with pharmacists regarding this, and it has been said to me that there is legislation with the Minister that would allow for this. I would ask the Minister, what stage is the legislation at, and when can we expect to see it to be implemented in order to prevent pharmacies and GPs from being overrun? Thank you, Minister.
Seanad Éireann.
Gaurav Mahagud, I would like to thank Senator Keogan for raising this issue. Thank you for welcoming me to the Seanad, and congratulations on your own appointment, election to the Seanad yourself. This is a hugely important question, and I think the fact that today, you mentioned older people, today is International Day of Older Persons, and I'm very conscious of that fact, and I think your question is very timely, because as we face into a winter with COVID in the backdrop, but also, facing the winter vomiting bug and the winter flu, I'm delighted to be here today to answer your question. We are all aware of the impact that COVID-19 has had on our healthcare system and our communities, and in the coming winter months there will be additional pressures on the health system and its providers. The Government believes that increasing wider access to the winter influenza vaccine is a high priority, needed to protect members of our society, especially the most at-risk groups, and to help mitigate our impact on the health service as the pandemic evolves. I would like to announce that the introduction of a new service development that will allow for influenza vaccination to be supplied and administered by appropriately trained pharmacists at locations other than on the premises of the retail pharmacy business, exactly the question that you asked about. This extension to current practice will enable pharmacists to provide vaccination services to a greater number of patients. By providing for an off-site vaccination service, it will also remove some potential practical barriers, such as capacity within the pharmacy premises due to social distancing recommendations and other public safety measures which are in place at this time. It also has the potential to greatly increase uptake of the influenza vaccine in all groups who can avail of the vaccine free of charge, in particular those at the at-risk categories, as well as patients wishing to access this service privately. This will help to alleviate some pressures and concerns around personal safety that patients may feel, particularly during these very, very challenging times. Potential locations for pharmacists may wish to provide this service may include a person's car, a person's home, a residential care home, a car park, including a drive-through service similar to COVID-19 testing services, a business premises, a school or other childcare facilities, a community or sports hall, as the Senator said. This amending legislation, which has been signed into law, underpins this new service development and is envisaged to be in place for the upcoming flu season. In support of this practice extension, the Pharmaceutical Society of Ireland is drafting additional guidance to support pharmacy owners, superintendent pharmacists and supervising pharmacists. These guidelines will enable the delivery of a safe and effective vaccination service off-site from the pharmacy premises. This guidance will be considered by PSI Council in early October, and it is envisaged that it will be then rolled out nationwide. It is also important to note that there is no limitation in regulation to the places where a GP may administer a vaccine. The only restrictions that existed applied to pharmacists. I am delighted to say the Irish Pharmacy Union is fully supportive of the new service practice. I would like to take this opportunity on behalf of Minister Donnelly to thank the PSI and relevant stakeholders for their assistance and support in the development of this service extension.
Seanad Éireann, you have 1 minute.
Thank you very much, Minister, and I welcome this, and I welcome the support that the Irish Pharmacy Union has given towards this programme and rolling it out nationwide and providing it to these outreach services. But we also need, there's 1,800 community pharmacists in this country, so with implementing the winter plan, we need to look at how we can work with them and see how best we can serve our communities around the winter plan for the HSE. So maybe we could use them more. They're an untapped resource there for the HSE and for the department, and I'm delighted to see that they are certainly welcoming this vaccine being rolled out. Thank you.
Sorry, Minister. Thanks.
The 2020-21 influenza vaccination season will be the 10th year that pharmacists have been permitted to provide a vaccination service on their pharmacy premises to patients. It is considered appropriate to build on the existing good practice and patient trust to further develop this service in order to meet the evolving healthcare needs of the public. And Senator, you are quite right. They are an untapped resource, and they offer fantastic service in all our communities. Minister Donnelly looks forward to seeing how this important service extension will be delivered, and he is very hopeful that it will have a positive effect on increasing access to the winter flu vaccination. Finally, I think it is important to acknowledge and appreciate the crucial role that pharmacists continue to play in our communities and healthcare system. So, Senator, thank you once again for raising this very important commencement matter today.
Thank you, Minister. Thank you, Senator.